The opioid epidemic has become a serious issue, not just for the city of Toledo, but for many other places as well. All over the United States, many cities are facing the devastation of an opioid crisis and a growing number of overdoses. Opioids include drugs such as heroin, fentanyl, oxycodone, morphine, and hydrocodone. According to the CDC, in 2017, the number of overdose deaths involving opioids, including prescription opioids and illegal opioids like heroin and illicitly manufactured fentanyl, was 6 times higher than in 1999. They also reported that 130 Americans die every day from opioid overdose. What can you do when someone is overdosing? In the last 10 years, there has been an increase in the use of naloxone to counteract opioid overdose. Naloxone is an opioid antagonist in that it blocks the opioid from the receptor and reverses the overdose. There is a nasal version of it that can easily be administered on site for someone experiencing an overdose. Naloxone, which can also be called Narcan, also can enter the body through an IV, which is something that first responders can be trained to administer. First responders are defined as individuals who, in the early stages of an incident, are responsible for the protection and preservation of life, property, evidence, and the environment. And they include police officers, EMTs, paramedics, and firefighters. Each of these professions are trained on how to save lives, and this is something they do each day on the job. As stated in the definition, they are responsible for the preservation of life. Naloxone is a drug that allows them to save lives. It allows them to provide someone experiencing overdose the ability to breathe normally again. We should not limit their ability to effectively do their job and preserve life. One of the characteristics of naloxone is that there's no way to build up a tolerance to it. It is just as effective the first time it is used on someone experiencing overdose as the 5th time. It will continue to bring someone back from overdose and can be repeatedly used in one sitting. There are no adverse effects of naloxone either. If used when someone isn't experiencing an overdose of opioids, nothing will happen. This is why it can be safely administered to first responders for them to carry, because nothing will happen if it gets in the wrong hands on a job site. Currently, there is an argument against allowing naloxone to be carried and administered by first responders, and it says that it will make people going through addiction less scared of the consequences of overdosing. There is the belief that people will take overdosing less seriously because naloxone could be administered to bring them back. But a study conducted by BMC Public Health in 2014 showed that although one prospective survey among people who inject drugs found that 35% of respondents anticipated that he or she would feel more comfortable using heroin after receiving a naloxone rescue kit, no studies of existing overdose education and naloxone distribution programs have demonstrated increased drug use by participants. One small study among people who inject drugs trained in overdose education and naloxone distribution reported statistically significant decreases in heroin injection at a 6-month follow-up. Another study conducted in 2001 by the Journal of Urban Health showed similar results regarding a decrease in heroin use with the addition of naloxone distribution programs and CPR training. Not allowing our first responders to carry naloxone sends a message to those going through addiction that we no longer care about them. It is telling them that we don't care about their disease, and that even though we have the ability to save them using naloxone, we aren't willing to do so. The Drug Policy Alliance released an article in 2012 written by Kim Fairnick, who speaks of losing her daughter Dana to a drug overdose at home. She writes, "In memory of Dana, I want to prevent future overdose deaths. One way to address this problem is for the state of New Jersey to expand access to naloxone so that it is not only available to emergency personnel, but also to lay people such as myself who may witness an overdose and therefore have the opportunity to administer life-saving naloxone to a peer or loved one. Not only does she believe that naloxone should be used by first responders and emergency personnel, but also by common people. This is a woman who was up close and personal with the opioid epidemic and knows what it is like firsthand to see someone experiencing overdose and not be able to help. If we don't allow our first responders to carry and administer naloxone, we are setting them up for the same experience as Kim.